All right, so I'm going to do really what Garen did is just not talk directly about the paper, but supplement the paper. The paper is perfectly fine, very competent analysis. Andy, though, is an epidemiologist and really likes these individual studies. I'm an economist, and basically 90% of what we do is ecological studies. So I'm going to talk more about the ecological studies. I'm going to talk a fair amount about suicide. That's because I didn't know Lanny would be here on my agenda when I did these slides. Lanny was not here, and now suddenly he appears. So, sorry. I'm going to talk about three things: suicide and firearm access, homicide and firearm access, and a little bit about the gun laws. As Andy said, there's overwhelming evidence in the United States that a gun in the home increases the likelihood of suicide, and he talked about a lot of the case control studies. It's not only the case control studies, but there are all these incredibly important ecological studies. We don't really have to worry much about the ecological fallacy here because we know that gun suicide victims use the household guns, and we know it's the gun which is the agent of suicide. Guns increase suicide in these ecological studies across regions, across states, and across cities. And the strong relationship is between having lots of guns in a community and gun suicide. There's no relationship between having guns in a community and non-gun suicide. The ecological studies have controlled for everything you could get your hands on, which is lots and lots and lots of things. The ecological studies show that everyone in the area, in the state or the region or the city, is at higher risk. The women are at higher risk, the men are at higher risk, the old people are at higher risk, the middle-aged people are at higher risk, the young people are at higher risk, and the risks are substantial. I'm going to show you the size of the risk. This is just to give you a flavor. This is women. We're just looking at the high and the low gun states holding nothing constant. But just to get a feeling, in high gun states, where we have the same number of women, even a little lower than in the low gun states, there were 7 times as many women in the high gun states committing suicide with a gun than there were women in the low gun states. There were about the equal number of women having non-gun suicides, and you see this across all things. And so not surprisingly, you have lots more women dying from suicide in the high gun states. The suicide connection, indeed, is what explains variations across areas in the United States. If you want to explain why there are more suicides in some states than in others, it turns out mental illness does not explain very much. Suicide ideation does not explain very much. Suicide attempts do not explain very much. What explains most of the variation is guns. We know also that gun owners do not have more mental health problems than non-gun owners. They have no more likelihood of suicide ideation or suicide attempts. And then, so not only do we have a whole lot of cross-sectional ecological supports, there's also some time series evidence. In the last 25 years, there's been one period where suicide rates went down, and that's in the 90s when gun suicide rates went down, and at the exact same time, household gun ownership went down. The gun-suicide connection also has very strong theoretical and empirical underpinnings. We know, for example, from lots of studies that many suicides are impulsive. We know the risks are transitory. We know that people, as our lunchtime speaker, who attempt suicide, even nearly lethal suicides, almost very rarely go on and actually die from suicide. This is just a study sort of showing how short the time is between thinking of suicide and actually attempting suicide, just to show how impulsive suicides are. The gun-suicide connection now, I think, is recognized by virtually all experts in the suicide field. The National Action Alliance for Suicide Prevention, the American Foundation for Suicide Prevention, this great organization, the American Association of Suicidality, the National Suicide Prevention Council, and on and on and on. We do surveys of gun researchers. One of the questions we asked this year was, do you agree or disagree with this statement? In the United States, having a gun in the home increases the risk of suicide, and by a 10-to-1 margin, people who know something about this area in this field agree. So I would argue the one thing, if we know one thing about guns in the United States in public health, is that a gun in the home increases the likelihood of suicide. Additional insights from the studies is that it appears that everybody in the home is at risk, not just the gun owner, but the gun owner's spouse and the gun owner's children. A gun increased the risk not for those people who are, quote, suicidal, but for everybody. And it seems like it's the handgun, which is more important access than the long gun, and handguns account for over 70% of all gun suicides. Let me talk about homicide. Again, here, there's very strong evidence, not quite as strong as the suicide evidence, that higher levels of household gun ownership are associated with much higher levels of gun homicide and thus overall homicide. The gun homicide connection is a little more subtle. In the suicide, the victim and the shooter are the same. In the homicide, the shooter and the victim are different. The case control studies have typically focused on the victims. And what they show really strongly is that a gun in the home is a risk factor for homicide in the home, but who's really at risk is the woman in the household who's not the gun owner. Why is she at risk? Because she's at risk from her intimate partner and the husband shoots the wife. But what about the gun-owning man? Is he at higher risk because he owns a gun in the home? Is he at higher risk of getting killed in a homicide? And the answer is we really don't have a good theory why that is. It may well be, but is it that when somebody, a burglar comes in the house, you'll have a shootout? Well, it doesn't seem that that's a lot of the problem. Having a gun in the home, if you're a man, I don't think the evidence is strong that it increases your risk of homicide, of being a homicide victim. What increases your victimization risk of being killed with a gun is that other men in the community have guns. That's your increased your risk. And this, I think, is what the population studies show. A decade ago, Lisa Hepburn and I helped review the literature on this and concluded the available evidence consistent with the hypothesis that increased gun prevalence in areas increases the homicide rate because it increases the gun homicide rate. And I think the evidence has gotten stronger and stronger and stronger. Here, again, this is looking at high gun states and low gun states. Here's looking at children. And what this says is that children in high gun states have about over twice the likelihood of being murdered with a gun. Now, they also have almost 12 times the likelihood of committing suicide with a gun, 9 times the likelihood of unintentional firearm deaths. Why only twice the homicide rate, victimization? And I would argue that that's because suicide guns and unintentional firearm death guns are home guns. The homicide guns, though, often move. So they're moving from states with lots of guns and weak laws to states with few guns and strong laws. So whose guns are killing young people in Massachusetts? It's guns which came from Vermont and New Hampshire and Maine and Virginia. Now, let me finish by talking about the effects of gun laws on homicide and suicide. And what I will argue is that there is, I think, fairly strong evidence that with areas where there's lots of gun laws, there's lower rates of homicide and suicide. Part of the reason is because where there's lots of gun laws, probably there's fewer guns. There's much less strong evidence that any particular gun law works. And I hate to say this, but 10 years ago, the National Academies of Science and the CDC separately did these evaluations of the gun laws, and they concluded, because they had a very, very high bar, that we could not say for sure that any gun law mattered. And I think we've learned a whole lot since then, but I think given that same high bar, they would reach that same conclusion today. And there are some laws where we have, here's 2 pieces of evidence and here's 3 pieces of evidence, but there's no law that I think you could say, I would bet 15 to 1 that this law really works. You might be able to bet 2 to 1, but I wouldn't. If I have time, I think. I want to just talk about the quality of the studies. Andy looks at these studies and basically says they're all very weak. They're not randomized control trials. But I want to say, and that's what the academies say, and I want to say yes or no, but you have to realize that among these studies, some are incredibly good for ecological studies and some are incredibly bad. And one of my pet peeves is about disaggregation, in that if you do a good study well, You really have to disaggregate. If you want to understand do right turn on red laws increase death in the United States, you don't look at do they increase death at the level of transportation deaths or at the level of motor vehicle deaths or even at the level of pedestrian deaths. What you do is you look at do they increase pedestrian deaths at intersections where you can make right turns on red. And if you don't do that, you have no statistical power to find out whether there's an effect or not. And a lot of the studies, unfortunately, that find nothing have no statistical power to find anything. And indeed, the ones that find something you should not believe because they have no statistical power to find anything. For example, one of the studies cited by Andy was this study that looked at 170 cities in 1980. And basically, what happened? What this crazy study basically, but it's a cross-sectional study, 5 dependent variables, 57 independent variables, 19 gun laws just thrown into the mix, everything. They did 2-stage least squares. All the gun laws could have affected gun ownership, but gun ownership's in the model as well. But what they're doing is they're looking at did these laws have an effect, say, on total homicide or gun homicide or total aggravated assault. So one of the laws, for example, is what if you prohibit minors from having guns? Well, you should really look at maybe that affects gun homicide by minors, but they don't look at that. They look at does that affect gun homicide by everybody? And it's really hard then if you find something, it's probably has no power to do that. One of the laws they look at is if what about prohibiting gun possession by drug addicts? Well, I'll argue maybe that'll affect gun assaults by drug addicts. Do they look at that? No. The model tests whether it affects all assaults by all people. And even if we eliminated all the gun assaults by drug addicts, that would be about 1% of all the total assaults by all people, and you wouldn't be able to find anything. And so if they find anything, not surprisingly, they don't find anything. And they make that as a big statement. Lots of Andy's studies, there are lots of studies of gun laws that are not included in Andy's review because of the narrowness of certain aspects of the review. There's a literature going on stand your ground laws. There's a huge literature, maybe 30 studies now, about concealed carry laws. Concealed carry laws are basically what's happening is we moved, it's a natural experiment, we moved from may issue laws to shall issue laws. What are may issue laws? It says police have discretion about whether to give you a permit to carry, whether or not you can pass a background check. Shall issue laws say we have no discretion. In Massachusetts, we have discretion. We just did a survey of Massachusetts police officers and said, did you use this discretion and when? They've used it about 1% to 2% of the time. When did they use it? And basically when somebody wants a license to carry and the police have been to their home 8 times in the past year for violence and drinking. And these are people who are at high risk. And allowing these people to carry is not necessarily a good thing. A problem is that all the studies have basically have no disaggregation. They didn't really look at whether the crimes occur inside or outside the home, and it's only outside the home the carry permits are relevant. They didn't look at whether the victims or the perpetrators had concealed carry permits. They didn't look at whether the victims or the perpetrators were carrying guns at the time of the crime. Sometimes we know where the perpetrators were. And they didn't look at whether even the main groups who were obtaining permits were more or less likely to commit crimes or to be victims of crimes. All they're doing is looking at aggregates. And the problem is that only a tiny percent of the population are obtaining permits, and these are people who are at very low risk for crime perpetration or crime victimization. They're basically the non-young, the non-poor, the non-minority, the non-urban. So if there's any effect, you're going to see it in the non-young, non-poor, non-minority, non-urban population, but they're looking at everybody. And so I would argue if they find anything, they've made a mistake. One of the famous articles found something. Andy has his criteria for judging. Here's my criteria, or, are the data accurate? Does the model pass the appropriate statistical tests? Are the tests robust to small changes in statistical modeling? Do the disaggregated results make sense? Do the results for the control variables make sense? Does the model accurately predict the future? And so forth. This is one way to see, is this a good evaluation? And basically, the most famous of these studies, the answer is no. The answer is none of these things are true. Right. So, a couple of minutes. Let me just conclude, and let me go down in sort of descending order of what I think the evidence shows. I think the evidence is just overwhelming. I would bet the farm, in other words, that a gun in a home is a major risk factor for suicide. I think the evidence is very, very strong that a gun in the home is a risk factor for the woman in the home. I think there's evidence is very, very strong that a gun in the community increases the risk for homicide, for people being killed. I think there's fair evidence, I'd bet 3 to 1, 4 to 1, 5 to 1, that stronger gun laws reduce homicide and suicide. And I would not bet 5 to 1 on virtually any of the gun laws, whether or not these particular laws are effective. But I would bet 3 to 1 or 2 to 1 on various ones. Thank you.